Welcome back to Men's Health Today. I'm Dr. Natalie. Today we're talking about a problem that affects many older men but often doesn't get discussed openly: waking up during the night to urinate. The medical term for this is nocturia. And while nocturia becomes more common as people get older, it isn't caused by one single thing. For some men, an enlarged prostate may contribute to urinary symptoms. For others, nighttime urination may be related to fluid intake, medications, sleep problems, diabetes, cardiovascular conditions, bladder problems, or other factors. And sometimes more than one factor can be involved. That's why today's video isn't about telling you that you have a prostate problem. Instead, we're looking at 7 everyday habits and patterns that may be relevant if you're constantly getting up at night. Before we continue, a quick medical disclaimer. This video is for general educational and informational purposes only. It is not medical advice, diagnosis, or treatment. Nighttime urination can have many possible causes, and the information in this video cannot determine what's causing your symptoms. If your urinary symptoms are persistent, worsening, painful, or concerning, speak with a qualified healthcare professional. Now let's get into the first habit. Habit 1: drinking or amounts of fluid close to bedtime. The first habit is one that seems obvious, but many men don't think about it. Drinking a large amount of fluid shortly before going to bed. Think about a typical evening. You finish dinner, then you have a large glass of water, maybe you have tea, then you sit down to watch television and have another drink. You go to bed, and a few hours later you're awake because your bladder is full. Then you go back to sleep, and a few hours later it happens again. Now, this doesn't mean you should avoid drinking water. Your body needs adequate hydration. The issue is that the timing and amount of fluid consumed in the evening may matter, particularly for someone who is already experiencing frequent nighttime urination. And this becomes even more interesting when you consider the types of beverages you're drinking. Because water isn't the only thing that can affect your nighttime routine. Here's what I want men to understand. If you're waking up several times every night, it's reasonable to look at your evening fluid pattern. But don't make the mistake of thinking, if I just stop drinking water, my problem will disappear. That's not necessarily true. If you're waking repeatedly despite reasonable evening fluid intake, there may be another reason for the nocturia. For example, urinary tract problems, prostate-related symptoms, sleep disorders, certain medications or metabolic conditions can all potentially play a role. So fluid timing is one piece of the puzzle, not the entire puzzle. Should I stop drinking water after dinner? Not necessarily. There isn't a universal rule that every man should stop drinking fluids at a particular time. Your hydration needs depend on your individual circumstances. The point is to recognize whether large amounts of fluid immediately before bed appear to coincide with your nighttime bathroom trips. And if you're unsure how much fluid is appropriate for you, particularly if you have a medical condition that affects fluid balance, that's something to discuss with your healthcare professional. What if I drink very little at night but still wake up 3 or 4 times? That's important. If you're limiting evening fluids and still repeatedly waking to urinate, don't automatically assume you're simply drinking too much. That pattern may deserve further evaluation. And here's where many men make their first mistake. They blame water. But sometimes the bigger issue isn't how much you're drinking. It's what you're drinking. Because the second habit is something millions of men consume every day without thinking about its possible connection to nighttime bathroom trips. The second habit is having caffeine too late in the day. For many men, that means coffee, but it can also mean tea, energy drinks, cola, or other caffeinated beverages. And here's why this matters. Caffeine can affect both urinary symptoms and sleep. For some people, caffeine can increase urinary urgency or frequency. But there's another part of the problem that's easy to overlook. Caffeine can also make it harder to sleep. So imagine this. You have coffee late in the afternoon or evening. You go to bed. You wake up during the night. You notice you need to urinate. Then, after getting back into bed, you have difficulty falling asleep again. Now you've got 2 problems happening at the same time: a bathroom trip and disrupted sleep. And that can create a frustrating cycle. Here's the important distinction. Caffeine isn't automatically a problem for every man. Some people are much more sensitive to it than others. So rather than thinking, coffee is bad for my prostate, that's too simplistic. A better question is, do I notice that caffeine later in the day seems to make my nighttime symptoms or sleep worse? That's a much more useful way to look at it. And if you're already waking up several times a night, paying attention to your caffeine timing may be relevant. Does coffee cause an enlarged prostate? No. You shouldn't assume that drinking coffee means you're developing an enlarged prostate. An enlarged prostate is a medical condition involving prostate growth, and caffeine doesn't simply cause the prostate to enlarge. However, caffeine can affect urinary symptoms in some people. That's an important difference. Can I still drink coffee if I wake up to urinate? For many people, coffee can still be part of their routine. The question is more about timing, amount, individual sensitivity, and your symptoms. If you consistently notice more urgency, frequency, or poorer sleep after late-day caffeine, that's worth paying attention to. What about tea? Tea can also contain caffeine, although the amount varies significantly depending on the type and preparation. So don't assume switching from coffee to tea automatically removes caffeine from your routine. But caffeine isn't the only evening habit that can interfere with your nighttime routine. There's another one that many men don't immediately connect with frequent nighttime urination, and it can affect both sleep and urinary patterns. That's alcohol. Habit 3, drinking alcohol close to bedtime. The third habit is drinking alcohol close to bedtime. Maybe it's a glass of wine with dinner. Maybe it's a beer while watching television. Or perhaps alcohol has simply become part of your regular evening routine. And you might think, it helps me relax, so it probably helps me sleep. But falling asleep faster isn't necessarily the same thing as getting good quality sleep. Alcohol can affect sleep patterns, and it can also increase urine production. So for some men, drinking alcohol in the evening can contribute to a night that's interrupted by both the need to urinate and difficulty maintaining good quality sleep. This is where I want to avoid another common mistake. Don't hear this and think, one drink means I'll be up all night. That's not what we're saying. The effects of alcohol vary between people and depend on factors such as the amount consumed, timing, medications, overall health, and individual sensitivity. The bigger point is this: if you're regularly waking several times during the night, and alcohol is also a regular part of your evening routine, it may be worth considering whether the two patterns are connected. Does alcohol cause prostate enlargement? Not in the simple sense people often suggest online. You shouldn't assume that drinking alcohol automatically causes an enlarged prostate, but alcohol can affect urination and sleep, which may make nighttime symptoms more noticeable. Why do I have to pee more after drinking? Alcohol can increase urine production. So if you're drinking several alcoholic beverages in the evening, you may be putting more fluid through your system during the hours when you're trying to sleep. And that can mean more opportunities to wake up and use the bathroom. What if I only drink occasionally? Occasional drinking doesn't automatically explain persistent nocturia. If you're waking up every night, regardless of whether you've had alcohol, there may be other factors involved. That's why persistent symptoms shouldn't simply be blamed on one habit. And now we're getting to something important. If you wake up at night to urinate, it's very easy to focus only on the bladder. You think, my bladder is the problem. But your nighttime bathroom trips are part of a bigger pattern. What happens during the day can provide important clues. And that's exactly what we're going to look at next. Habit 4, ignoring daytime urinary changes. If you're getting up repeatedly at night, but you're also noticing changes during the day, don't ignore them. Maybe you're urinating more frequently. Maybe you suddenly feel a strong urge to go. Maybe your urine stream isn't as strong as it used to be. Perhaps you have trouble getting started. Or maybe you finish urinating, but still feel like your bladder isn't completely empty. These symptoms can occur with an enlarged prostate, which becomes increasingly common as men age. But they can also have other causes. That's why the entire pattern matters. Here's the mistake I want men to avoid. Don't treat nighttime urination as an isolated problem if you're also experiencing daytime urinary changes. The combination can provide more information than one symptom by itself. For example, repeatedly getting up at night plus a weak stream and difficulty starting urination is a different pattern from simply drinking a large amount of water before bed. It doesn't tell you the diagnosis, but it does give a healthcare professional more information to work with. Does a weak urine stream always mean an enlarged prostate? No. A weak stream can have several possible causes. An enlarged prostate is one possibility, but it isn't the only one. That's why persistent urinary changes shouldn't be self-diagnosed from one symptom. Is getting up once a night abnormal? Not necessarily. Nighttime urination varies among individuals, and occasional waking doesn't automatically indicate a disease. What matters is the frequency, persistence, severity, and whether it's disrupting your sleep or daily life. When should I take it more seriously? If the pattern is new, persistent, getting worse, or significantly interfering with your sleep and quality of life, it's reasonable to discuss it with a healthcare professional. And certain symptoms, such as blood in the urine, painful urination, inability to urinate, fever, chills, or significant pain, deserve medical attention rather than being dismissed as normal aging. So now we've covered 4 important patterns: large amounts of fluid before bed, caffeine too late in the day, alcohol close to bedtime, and ignoring daytime urinary changes. But we're not finished, because the next habit involves something that can seem completely unrelated to your bladder. And it may be one of the reasons some men wake up repeatedly even when they aren't drinking excessive amounts of fluid. That's where sleep enters the picture. Habit 5: ignoring what you eat and drink in the evening. Another habit that can be easy to overlook is your evening food and drink routine. You might think, what I eat at 8 p.m. can't possibly have anything to do with why I'm getting up at 2 a.m. But for some men, certain foods and beverages can make urinary symptoms more noticeable. This can include things like caffeine, carbonated drinks, alcohol, or foods that an individual finds irritating to the bladder. And there's an important word here: individual. There isn't one universal food that makes every man's nighttime urination worse. One man may notice a particular drink causes more urgency. Another may notice no difference at all. So the useful question isn't, which food is guaranteed to stop nighttime urination? There isn't one. The better question is, do I repeatedly notice a connection between something I consume in the evening and my nighttime symptoms? This is where I want to be careful with the advice you see online. You may see claims like, eat this one food before bed and your prostate will be fixed, or drink this and you'll stop waking up to urinate. Those kinds of promises are much stronger than the evidence supports. Nighttime urination can have multiple causes, so changing one food doesn't necessarily address the underlying reason. If you consistently notice that a particular evening food or beverage seems to make your symptoms worse, that's useful information. But don't turn that observation into a diagnosis. Are spicy foods bad for the prostate? Not necessarily. Spicy foods don't automatically mean that your prostate is unhealthy. However, some people find certain foods irritating to their bladder or urinary symptoms. Your individual response matters. Should I stop drinking all fluids at night? No. Your body still needs appropriate hydration. The goal isn't to become dehydrated in an attempt to avoid the bathroom. If you have a medical condition that affects your fluid requirements, follow the guidance of your healthcare professional rather than using a general internet rule. Can one food cure nighttime urination? There is no single food that can be presented as a guaranteed cure for nocturia. If the underlying cause is an enlarged prostate, a sleep disorder, diabetes, medication effect, or another condition, changing one food won't necessarily address that cause. Habit 6: treating poor sleep as just getting older. Now let's talk about a habit that has nothing to do with what you're drinking. Ignoring persistent sleep problems. This is important because sometimes a man wakes up during the night and immediately assumes, my bladder woke me up. But that's not always necessarily the whole story. Imagine you're sleeping very lightly. You wake up. You're already awake, so you notice that your bladder has some urine in it. You get up and use the bathroom. Then you go back to bed. This can happen repeatedly. And now you may think your bladder is waking you several times when disrupted sleep may also be part of the pattern. Sleep and nighttime urination can interact in complicated ways. And if you're also dealing with loud snoring, gasping during sleep, excessive daytime sleepiness, or consistently poor quality sleep, don't simply write it off as, I'm over 60. Getting older doesn't mean you have to accept every sleep problem as inevitable. Persistent sleep problems can deserve their own evaluation. And this is especially important because poor sleep can affect your overall health and quality of life, regardless of what is happening with your urinary symptoms. How do I know whether my bladder or my sleep is waking me? It isn't always possible to determine that on your own. Some men wake because they genuinely need to urinate. Others may wake for another reason and then decide to use the bathroom because they're already awake. And sometimes both factors are involved. If you're repeatedly waking during the night, especially if you're also exhausted during the day, discussing the pattern with a healthcare professional can help identify possible causes. Does snoring have anything to do with nighttime urination? It can be relevant. Certain sleep disorders are associated with nocturia, so persistent loud snoring, pauses in breathing, gasping during sleep, or significant daytime sleepiness shouldn't simply be ignored. That doesn't mean snoring automatically explains your nighttime urination. It means the sleep pattern may be worth discussing. Is poor sleep just normal after 60? Sleep patterns can change with age, but persistent or significantly disruptive sleep problems shouldn't automatically be dismissed as an unavoidable part of aging. So now we've reached 6 habits and patterns. We've talked about evening fluids, caffeine, alcohol, daytime urinary symptoms, evening foods and drinks, and sleep. But there's one final habit that may be the most important of all. And unlike the first 6, this one is less about what you're doing and more about what you're assuming. Because many men make this mistake for years. They wake up night after night. They become increasingly frustrated. And they tell themselves, I'm over 60. This is just normal. That brings us to number 7. Habit 7, assuming frequent nighttime urination is just normal after 60. 7th habit is actually a mindset. Assuming that frequent nighttime urination is simply something you have to accept because you're getting older. Yes, nocturia becomes more common as people age, but common doesn't automatically mean something you should ignore. That's an important distinction. If you're occasionally waking once during the night, that may be very different from waking 3, 4, or more times every night and feeling exhausted the next day. And if the problem is persistent or getting worse, it's worth asking, why is this happening? An enlarged prostate is one possible explanation for urinary symptoms in older men, but it isn't the only possibility. Nighttime urination can also be associated with excessive evening fluid intakes, certain medications, diabetes, sleep disorders, bladder conditions, urinary tract problems, cardiovascular conditions, and other medical issues. Sometimes more than one factor is involved. So the goal isn't to scare yourself into thinking, I must have prostate disease. The goal is to avoid the opposite mistake. I'm older, so there's nothing worth checking. If something is persistent and affecting your sleep or quality of life, understanding the cause is more useful than simply accepting it. Is waking up once every night normal? Nighttime urination varies from person to person. Waking once does not automatically mean that something is wrong. The more important questions are, how often is it happening? How long has it been happening? Is it getting worse? And is it affecting your sleep and daytime life? Does getting up several times mean I have an enlarged prostate? No. An enlarged prostate can cause urinary symptoms, including nighttime urination, but multiple other conditions and habits can also contribute. You can't determine the cause from nighttime urination alone. When should I talk to a doctor? If your nighttime urination is persistent, worsening, or significantly interfering with sleep and daily life, it's reasonable to discuss it with a healthcare professional. And some symptoms deserve prompt attention rather than being dismissed as aging. These include blood in the urine, painful urination, inability to urinate, fever or chills with urinary symptoms, or significant pain. Let's quickly go through the 7 habits and patterns one more time. Number 1, drinking large amounts of fluid close to bedtime. It's not about avoiding hydration. It's about recognizing whether large amounts of evening fluid may be contributing to your nighttime bathroom trips. Number 2, having caffeine too late in the day. Caffeine can affect urinary symptoms in some people and can also interfere with sleep. Number 3, drinking alcohol close to bedtime. Alcohol can affect both urine production and sleep, potentially making nighttime awakenings more disruptive. Number 4, ignoring daytime urinary changes. If you're also experiencing urgency, frequency, a week's difficulties, or a feeling of incomplete emptying, don't focus only on the nighttime symptoms. Number 5, ignoring your evening food and drink patterns. There isn't one magic food that causes or cures nocturia, but certain foods or beverages may aggravate urinary symptoms in some individuals. Number 6, ignoring persistent sleep problems. If you're snoring heavily, waking frequently, or feeling exhausted during the day, your sleep may be part of the bigger picture. Number 7. Assuming frequent nighttime urination is simply normal after 60 age can make nocturia more common, but persistent, worsening, or disruptive symptoms shouldn't automatically be dismissed. Here's the most important point I want you to take away from this video. Getting up at night to urinate isn't always just a bladder problem, and it isn't always just a prostate problem. Your urinary system, sleep, medications, fluid intake, metabolic health, cardiovascular health, and other factors can all be relevant. That's why trying to find one magic solution from the internet can sometimes miss the bigger picture. You may see claims promising that one food, one drink, or one simple trick will completely fix nighttime urination. Be cautious with those claims. If the underlying cause hasn't been identified, there may be no reason to expect one simple trick to solve everything, when you should not ignore it. There are also situations where you shouldn't simply wait and see. If you notice blood in your urine, painful urination, difficulty or inability to urinate, fever or chills associated with urinary symptoms, significant pain, or a sudden major change in your urinary function, seek appropriate medical evaluation. And even without those warning signs, if you're waking repeatedly every night and it's leaving you exhausted during the day, it's reasonable to discuss the problem with a healthcare professional. You don't have to assume that this is simply what happens after 60. So if you're getting up night after night to use the bathroom, start by looking at the whole pattern. Ask yourself, how much am I drinking in the evening? How late am I having caffeine? Am I drinking alcohol close to bedtime? Am I experiencing urinary changes during the day? Do certain evening foods or drinks seem to make things worse? Am I sleeping poorly for another reason? And most importantly, have I simply accepted this as normal without trying to understand why it's happening? Those questions won't diagnose the cause, but they can help you recognize that nighttime urination is worth paying attention to when it becomes persistent or disruptive. If this video helped you understand your nighttime urinary symptoms a little better, subscribe to Men's Health Today. Here we talk about prostate health, urinary health, erectile health, testosterone, blood circulation, nutrition, and healthy aging for men over 50. And remember, common doesn't always mean you should ignore it. If you're repeatedly waking up at night to urinate, especially if the problem is getting worse or affecting your daily life, consider discussing it with a qualified healthcare professional. I'll see you in the next video.